Hello, my name is Ben Spiegelberg. I'm a trauma and orthopaedic surgeon specializing in hip and knee surgery. I chose my specialty of trauma and orthopedics because it makes such a huge impact in patients' lives. The success of surgery, particularly from treating hip and knee osteoarthritis for a patient with severe pain to someone who is then able to walk pain-free, is a really rewarding perk to my job, and having the thanks of making a real change to patients' lives is so gratifying, so rewarding on a daily basis. There are a number of things that I find rewarding in my job, and that's why medicine in general is such a great career to embark on. For me, I do a lot of training, so training the doctors of the future is a great perk and real privilege to be able to be involved in. The job itself, treating patients with hip and knee problems. Also, I do trauma, so fixing fractures and getting patients back to mobility, pain-free, is a really rewarding aspect. And seeing my post-operative patients come back in the clinic and hear them tell me what a difference their life is following the surgery is a very rewarding aspect, and makes me very thankful that I'm in that position and grateful that I'm in that position to be able to help patients. It's a difficult question to answer what patients most value about me. I think my characteristics are ones of honesty, integrity, humility, empathy, and I hope those characteristics enable me to be able to converse and make a patient feel confident in my treatment, comfortable in my with me in clinic, and have trust in my ability to treat them for their ailments successfully. We face quite a significant challenge in the speciality of trauma and orthopedics at the moment, in particular elective orthopedics. Coronavirus and the pandemic has really affected our waiting lists, especially in the National Health Service, which is very well documented. So our ability to treat the number of patients that we have on our books has been significantly curtailed due to all the factors associated with the pandemic. So that really is the most difficult aspect at the moment, is trying to deal with the burden of pathology and patients who need surgery, and yet our waiting lists are getting more and more. So it is quite stressful listening to patients who are in significant pain without necessarily a way to click my fingers and sort the problem out. We're all trying our hardest to get through our waiting list as quickly as possible, but the waiting list keeps being added to, and if we have further lockdowns in our practice, then that will make the waiting list even longer.